I think Chris is on here. How you doing, Chris? Let's see who else is on here.
When you're down in trouble,
this is my song for today.
You need some love and care. Ain't nothing going right.
Hey, Dr. Burns, how you doing?
Close your eyes and meditate on Him. And soon He will be there.
He will be there.
God can brighten up.
Hi, Annette.
He can brighten
Hello,
up.
Tanisha. Miss Angelina.
Your
The darkest hour. Hello, Erlene. Hello, Marja. Good for you, Gina. Got her walk in. Hello, Rita. Hey, Michael. Hey, Debbie. Here's Sherry Paige Robertson. Hello, Rita. Precious Lord. Hey, cousin Orlando. Hello, Linda Brock. Thank you, Debbie.
I'm weak.
It's my homegirl, y'all. Queen of Soul. Yes. Hi, Chanel and Elle. Hey, Debbie. Hey, Michael. You got a friend. You got a friend in Jesus.
You got a friend in Jesus. Yes, you do.
You got a friend.
You got a mighty good friend in Jesus. I wonder, do you know it?
Do y'all know that? You gonna know after today.
You got a friend in Jesus.
Yes.
Yeah.
Ain't nobody do that like Aretha. Hey, Pat. I used to hear this song growing up at home on my parents' stereo on a, what do you call them things, records. Y'all just give me a couple more minutes. I gotta hear the rest of this. I'm sorry. I'm just feeling this right now. You need to know you got a friend. Nobody else is your friend. Jesus is your friend. All day, all night. Ooh, Jesus. Yeah. I can shout here all by myself. Woo! All right. Give it up for Aretha Franklin, Queen of Soul. Anyway, just want y'all to know y'all got a friend, all right? And I'm your friend too. How's everybody doing today? It's Dr. Martin here. I'm so excited because we're going to do something a little bit different today. Before I introduce the guest, I want to say hi. And just want to say a couple of things about something great that's happening in Maryland as it pertains to the pandemic. Our governor has opened up is opening some more testing sites that are free, and you don't have to have a symptom, and you don't have to have a doctor's order. I was wondering where all the tests were he got, and now I think I found out. So they're going to be, I have the 4 locations that are coming up. Timonium Fairgrounds in Baltimore County, Glen Burnie site in Anne Arundel County, Hyattsville VEIP, that's the vehicle emissions place in Prince George's County, and there's going to be one available in Clinton next week. That is great news. So if you're in our area and you just want to test, guess what? In Maryland, if you want to test, you can get a test. I'm so excited about that. Because all I've been talking about is tests and masks and isolate. I know y'all sick of me, but that's what we need. So that's exciting news happening in Maryland. As of today, I think all the states have opened up something to some degree. Some of those places that have opened are seeing upticks in cases, but the thing that's working, you guys, was the isolating and the mask. You got to go out and make sure you got a mask on. I know we're trying to get back to our lives, but do it with a mask. Okay? Please be careful. Please be careful. So, Oak Park, Michigan is having free testing. Awesome. Great. It needs to be free. If they took some of this money they're doing for other stuff and paid for people to test, paid for people to track the contacts and isolate these individuals, the economy will be back on its feet sooner than later. But, that's just my opinion. So anyway, I'm excited because I have with us tonight, I promise you guys, and I hope you're ready for her. I told you to get ready. A dear friend of mine. She's a colleague as well, a sorority sister. She graduated from the great Howard University College of Medicine, just like I did. So she's the bomb. And she's a renowned dermatologist. And she's going to come on tonight to talk to you guys about any hair, skin, nail conditions, concerns, questions you may have about your hair, your skin, your nails, since we've been under this pandemic. So I'm going to bring forth Dr. Melanye Maclin. I'm trying to, Joan. You got her. Okay. Hey. How you doing, Mel? Dr. Mac?
Good. Hey, everybody.
I'm so glad you decided to come on with us tonight. I know we've been talking about everything COVID, everything Corona for the past few weeks. And I know individuals have some concerns about hair, skin, and nails and things like that since we've been under this pandemic and isolated, right? So before we get started, tell them a little bit about what you do and what you've done and things like that.
Oh, that was for you to do, Dr. Mimi. But no, thank you so much for having me on. I'm really excited to be able to share information with your viewers. Essentially, I'm born and raised in Chicago, so Mimi is my Midwest homegirl almost. So came to Howard University, went to Howard University Medical School. After that, I did a Johns Hopkins Hospital in Baltimore for my medical internship, and then dermatology at Washington Hospital Center, and pretty much have been here in Maryland ever since then. So I have a company, Innovative Hair Technology, that we do product development. Our signature products are Belanutri hair and skin supplement for women and Bonutri hair and skin supplement for men. So my main focus outside of those two products is also doing product development for other big companies or even small companies. And more importantly, it's doing media education to from a multimedia perspective to help people with their hair and skin questions, because a lot of us can't get to one of us as a dermatologist. We may not have the insurance, we may not be able to get to a dermatologist, we may not have the funding, whatever the case may be. It's always been my passion to reach out to us on a national perspective through my Ask Dr. Mac platform, where folks can literally talk to me or email me or whatever for free. And this is actually, I started that system back in September of 99, and we're still going strong. And then, all the magazines, radio, Mimi, it's whatever. I definitely just try to keep myself active with providing information to help us.
And I can testify for a fact she's doing a great job at doing that.
Okay.
So before you guys start putting in your questions, I have a couple of questions for you, Dr. Mac.
Okay.
That specifically relate to the pandemic. So we're hearing a lot about this multi-system inflammatory syndrome with the children with Kawasaki's disease. Can you tell the parents on this broadcast, there's a rash kind of associated with that? And could you tell them a little bit about
that? Okay. And, essentially Kawasaki's is mostly an inflammation of our children's blood vessels. Okay. It's more of the smaller and medium-sized blood vessels. And generally it's going to be found in kids that are under 5. Now, what we're hearing right now is this, sort of variety of different types of skin issues that are going on. I mean, kids are presenting with like measles-like reactions, which are kind of like a fine red bump all over their bodies. They may have isolated red patches or red bumps. The skin all over from head to toe may be diffusely red. And then you may see your child with diffuse peeling, like the skin is peeling. The good news about it is that it resolves on its own in a few weeks. So that can make parents feel a little bit more comfortable that this is not going to be something permanent that's happening in their child. But as their Kawasaki's concern goes on, and that starts to like diminish and reduce, so will the skin symptoms. So it's not going to be something that's permanent. That's going to be permanent for your child.
Awesome. Anybody have any questions for Dr. Mac about Kawasaki related or any type of related skin or hair or nail issue? I have another question while we're waiting. They talk about a sign called COVID toes.
Oh, yeah, this whole COVID, Dr. Mimi, is really just is so many different fluid situations going on, which means people are having such a variety of different symptoms. And I actually said this when this whole infectious came to to be so pronounced. I said, I guarantee there will likely be some sort of skin affiliation, and I'm going to be on the lookout for it. So I really kind of called this because our skin is the largest organ in the body. So naturally, if we get a virus that's going to infect our respiratory and get internal, infecting our bloodstream, it can affect the skin. So there's been like this really deal with COVID toes, where the people are coming in with either red or purple toes, or there's red or purple bumps, and they're describing a pain, tenderness, or burning sensation. The good news about this, it too will resolve over a couple of weeks. But what people need to know is that as long as those symptoms of that red or purple toes with any associated symptoms, that's the same time period that they're still infectious. So until those symptoms go away, then that's when you'll start seeing the virus start to diminish from a person's system.
It's very interesting because initially we're thinking it's a respiratory disease, and it's affecting all our organ systems.
Multi-system.
Multi-system.
And they talk about the deal with this, the strokes that are especially they're seeing in like the younger population.
Yes.
And I feel that has the same sort of pathophysiologic thing that goes on with the toes, where there's probably some blockages going
Mm-hmm.
on, and the blood is probably getting thicker, getting inflamed, and causing
Mm-hmm.
more blood clots.
Yes, it's
Hence, people getting strokes, and hence people getting the red, purple toes. So this is
yeah,
really a fluid situation that we
it's
have to
very
really closely
fluid.
monitor.
And
Yes.
we're learning more and more like as every
Yeah.
day goes on. So that's why I
Me too.
tell everybody just stay tuned. Something else is gonna
Mhm.
pop up.
We have
Patricia,
any questions?
I'm sorry, go ahead, Dr. Mac.
I said we have any questions? Let's see.
Yeah, there's one up there. That's my sister and our soror. She wants to know what to use on her hands. Her hands are very dry.
Ooh, hey, Sora Patricia. Okay, so yes, because now we are having to wash our hands literally like probably every minute or two or
Yeah.
three. The more the merry and the better. But yes, it too can dry out the skin. One thing that's great is when after you have what, and it's we prefer you to wash your hands for at least 20 minutes versus just using the sanitizer. But either way, those are drying out the hands. And so any sort of like petrolatum based product, like even basic white petrolatum, Vaseline, you can simply coat your hands with that, which will actually act as a protected barrier to just kind of
Mhm.
trap in some of that skin moisture so that then the skin doesn't have a chance to crack and get all of that little kind of crusty kind of look. Um,
Exactly.
and and honestly, what we it's kind of like a little trick that we used to do for the babies at night when they had bad eczema. We would say coat, have the parents to coat the hands with Vaseline and put on some gloves at least for a
Mm-hmm.
couple of hours, and
Mm-hmm.
that really will help to kind of trap in some of that moisture. But we can't take away the fact that we need to stay safe, and that takes precedence over whether or not we have dry hands. We want safe hands.
Exactly, exactly. And so
Right.
I feel that because I'm washing my hands constantly at work, and then after I wash, I put hand sanitizer, and then I
Right. So
put my,
so you doubling up. You've got
yeah,
the detergent chemical that's in that from the washing of the hands, and then you've got the alcohol.
alcohol and the sanitizer. But I ended up every few minutes with some shea butter on top. So
Right. So to your point, shea butter. I just tend to like white petrolatum. That's in the
mhm,
you like Vaseline because number one, it's
mhm,
really inexpensive, but
mhm.
it really helps to trap, which is the key word.
Moisture.
Other oils like shea butter, coconut oil, olive oil, and those other type of oils that are used in some hand lotions, they absorb through the skin more.
Mhm.
So even after a couple hours, you can still have the dryness.
Yeah.
However, if you use a petrolatum base, it's going to trap the moisture.
Got you. Got
Yep.
you. Very good, good stuff. We have a lot of questions here. Let's
Okay.
see. I'm not being what do you call it? It's nepotism, but this is my sister again. I'm gonna get to everybody. I have another
Oh,
sister. My other sister's on here. She says my daughter has enough hair for 10 people. Yes, she does.
okay.
Oh my God, lots of hair. She wants to wear her hair natural. It is dry. I don't want to break it off. What do I do so I don't cut it off while she sleeps?
Oh no, Mama Chris, don't cut off that beautiful baby's hair that you and her have worked so hard to get on her head. But no, first of all, I have to say this. I'm so glad that she wants to keep the hair natural.
Mhm.
Because I mean, Dr. Mimi, you probably heard me talk about this on many occasions. Speaking of the adverse effects of using chemicals like in the relaxers too early in our
Mhm.
babies that can
Mhm.
adversely affect their reproductive tract,
Exactly.
and causing early menses, early puberty, fibroids. So we want to keep, which has been my national sort of campaign, chemical free curls for healthier girls. So that's great, Mama Chris, that you are going to abstain from putting chemicals on her hair. But what you can do, one of my favorite tricks, I love olive oil. Olive oil
Mhm.
loves the keratin protein, but you can also use things like coconut oil, is another one. But you can simply, the night before you shampoo her hair, saturate that scalp and hair with any type of olive oil. Put a plastic cap, wrap her hair in a scarf, and then the next day wash it. You will be amazed as to once again how the oils actually are trapped within that hair, and the shine and the less breakage and the less brittleness that you'll see with baby girl's hair. So olive oil, saturated plastic cap, scarf, voila, nice
Before she
crisp.
washes it.
Let's try it.
Okay, good,
Yeah.
good.
And you can do that same thing with the coconut, same kind of concept.
Okay.
Hmm.
We have Tanisha Mickles, another soror, and her
Okay.
question is: she has a blind bump, and I don't know what that means exactly. I don't know, a blind bump on her back that just won't seem to go away. What can I do?
A blind bump, maybe. Oh, so
Yeah.
hey, Sword Tanisha. Okay, so it it's hard to say because I'm not sure. Maybe you can explain what a blind bump is.
Or maybe
Is
it's
it
a
something
typo.
you're
I
not
don't know.
seeing? Does that mean it's something skin color? If it's something skin color that's a bump on the back, it could either be a cyst. Um, it could be what we call like a dermatofibroma, which there may have been like a prior scar in that area, and it led to like a little flesh-colored bump on the back. It's really hard to say unless we kind of have a little bit more. Either it's hard to do a picture, but of course, when she's saying blind, maybe be more descriptive.
Right. Okay.
Mm-hmm.
Um, she said
Google.
she Google. Oh Lord, don't
What
start us
what did
on the
she Google?
Google.
Sorry, Tanisha. Don't use Dr. Google. I got your back too.
Oh, we're not gonna talk about that on here, Tanisha. I'm gonna call you later. Okay. So C Johnson says she says like an embedded bump.
It's like an embedded bump up underneath the skin. So that's likely like an epidermal cyst, like a
Mm-hmm.
skin cyst that she probably can't see that it has like a center hole in there. And that can simply be excised. It has to, in order for it to, if that is a true epidermal cyst, the only way for it to go away is it has to be like removed surgically, like to be able to remove that whole cyst sac. But I think that's probably what most likely what it is, Tanisha.
Okay. Very good.
Mm-hmm.
Let's see. Let's see. C. Johnson says, and I think she's talking about the inflammation of the skin. Is there something similar that's happening to adults as far as the inflammatory processes we're seeing in the children?
And that's a great question because once again we're in a very fluid situation on what's happening. A lot of things that even from skin related issues that are going on, they're somehow still grouping it under possibility related to COVID. So it's hard to say. But if you have something that has come about and you're not sure, or this is something new, then I would certainly go and get that checked out, because we are now realizing that the COVID is attacking the blood vessels, and it can yield a similar sort of skin reactions that the multi-system and the Kawasaki's is going to children. So it's
Okay.
hard to say, but if you see anything suspicious, it's definitely best to. And that's something that you could probably get on a telehealth call with a dermatologist or your regular doctor.
Exactly.
Mhm.
Telehealth is really getting a lot of use these days.
Oh yeah.
Okay, so one of our guests ventured out because it's getting nice outside and we're working in
Hmm.
the yard and got a tick on their skin. So, can you talk to them a little bit about the rash associated with Lyme
Lyme
disease?
disease.
Yeah.
Right.
Mhm.
Right. And so that's one thing, that it can start as like a little small red bump at the site where the tick bit, and then it can start expanding. What is it? Erythema chronica
Chemical
migraine.
migrants.
I
Yes,
had to
ma'am.
dig deep back. This is, let's say it's been 20 years, 21 years since
30
I've
for me,
been.
30 something for me. So,
Right. But yeah, it will look like an expanding sort of rash and a circular sort of form in that area where the bite is. So definitely be very observant. I would still go in and, like, take some sort of like Benadryl if you're itching, something to just kind of keep the histamine response down, and just observe. And
mhm.
it might be warrant you also. I encourage people to take pictures of anything that pops up, and do that every couple of days, so that you can see how it's evolving or not. Because what we
Mhm.
may not remember how it looked a couple of days ago. So it's always good to take a photo diary of any sort of skin thing.
Awesome, awesome.
Mm-hmm.
We have another question from Michael LaCour. And she asked, is there a brand of shampoo conditioner you recommend for natural hair?
Woo. Okay, that is a tough question, because there are a lot of wonderful natural hair conditioners, shampoo and conditioners. Um, I would say this to keep it general, because I really don't like talking about one in particular, because a lot of them generally use this, similar formulations. But
Hmm.
what I would be cautious with is if someone hands you a shampoo and conditioner that they just made at home and put in the refrigerator and gave you to use. And I say that because, you know, products that are freshly made, they need preservatives in order to last. Otherwise, you will get bacteria buildup in that shampoo or conditioner. So definitely you want to kind of avoid, you accept those gifts with loving, with a love in your heart, but let's make sure to stick with some sort of um, preparation that has preservatives in there, because a lot of natural products use a lot of the essential oils, the shea butter, they use the coconut oil, the olive oil, the avocado oil, and things of that nature. And they need to have preservatives in order to make sure that we're not getting any sort of bacterial infection from that shampoo and conditioner. So really, honestly, whatever's your favorite is really whatever you like. Um, you just want to make sure to also, you know, um, add. Okay, because so a lot of times people think that they can only use shampoo and conditioner, and they're not going to use too much other oils afterwards. But our hair is very dry. Our hair is naturally, it doesn't. Our oil sebaceous glands are not as active, so we need to not only just think about the shampoo and conditioner, getting the moisturizing components from that, but also what are you putting on after you're doing that shampoo and conditioner. So it's really no favorite. Use whatever you like, but just make sure that you're using it properly, with that has some sort of preservatives in there, so you're not getting any sort of bacteria buildup going on, and then you're putting on something after. So um, I don't speak on the brand. I just speak on the
Oh,
concepts.
all right. That's smart. You're a smart woman.
Yeah.
All right. Ashley Wusa has a question. She
Okay.
says, Dr. Mack, I've been on steroids similar to
Mm-hmm.
prednisone for 6 weeks.
We all know about that. Okay.
Prior to getting sick, I was using AHAs, retinoids, and some niacinamide. Is it still safe, a good idea to use specifically retinoids while on steroids?
Oh, okay. Well, the steroids are not going to adversely affect or cause any side effect with the retinoids. And so I'm assuming that she's probably, using the retinoids for, I don't know if she has some sort of underlying acne or clogged pores. Maybe she can be more specific, or she's using the retinoids for helping with fine lines and wrinkles. Can you chime in and who just typed the question in? Is it Ashley?
Yeah,
Is
Ashley
because
Wusa.
the only thing that we would really be concerned about with the retinoids is sun exposure. So anytime someone is using retinoids, I always say try to do that at nighttime instead of the daytime, because definitely the UV light, from even the office lights, and certainly the UV rays from the
Mhm.
sun can really create a very irritant reaction with the retinoids.
Let's see.
Um,
I didn't know that about the office lights. That's
Office
good
light, the
information.
fluorescent lights are still in
Mhm.
that UV range,
Yes, I didn't think
similarly
about that.
to the the UVB rays that we have in the sunlight. So even when you're sitting in your office, and if they're fluorescent lights, and you don't have any sort of sunscreen on your, especially your
Mhm.
face, you still are at risk for all of the sun related skin issues. So yes,
Okay,
no
good.
matter your melanin color, from light brown to dark brown to the darkest black brown, we
Okay.
still need to protect our skin.
All right. Thank you. I
Hmm.
think Ashley chimed in and said she's using the retinoids for preventative for wrinkles.
Oh, okay, okay. So it's not going to interact with your steroids. That's number one. Number two, definitely use that at nighttime.
Okay.
Yeah.
Awesome.
Hmm.
Okay. I have another question here because, during this time of the pandemic, there's a lot of anxiety and stress, and
Hmm.
some people's eczema and skin lesions are flaring up. So this person wanted to know, what do you recommend for eczema flare ups?
Well, eczema is a broad category. So are we? So if it's an adult that's experiencing the eczema flare ups, we sometimes we want to group stress with everything. And
Mhm.
true enough, stress can exacerbate lots of different issues throughout our
Mhm.
body, and especially the skin. But I would submit to that person, it may not necessarily be related to the stress. We have
Mhm.
to still go in and look, into what is our diet. really taking a you know, fine diary, a daily diary of
Mm-hmm.
everything that you eat, everything that you're applying to your skin, even your laundry detergents. There's
Mm-hmm.
so many of those that are causing eczema flares. So I would say you have to start with a daily diary of everything that you're doing to your skin. What are you taking internally? And maybe you yourself may be able to zone in on, oh my goodness, I didn't know that those apples that I was eating every day trying to
Mm-hmm.
be healthier instead of the cookie, that it's causing my eczema flare.
Mm-hmm.
So I think with that, with anything eczema related, I always have people to think about what all the things that they're doing, from topicals,
Mm-hmm.
internal supplements. People are overdosing on so many supplements, but take a clear cut, journal, if you will, of everything. And it may not necessarily be related to the stress, but yeah.
Okay, good.
Mm-hmm. Mm-hmm.
Got a couple more questions. Bernadette says, I have an in-ground swimming pool. I'm not sure if I should open it right now. Is it safe to swim? I don't know if she's referring to, is it safe for her skin or safe to swim in general? But if you could speak on.
Girl, this is a stressful time. You better open that pool. I opened mine.
I'm ready to come down and get in yours.
Right. Come when we opened ours in March, as soon as the pandemic hit and they said everybody's quarantined, my husband called the pool company. He said, "Look, we got to have something on the bright side to look forward to."
Exactly.
But no, absolutely, the pool water, especially if it's your own private pool, is absolutely safe to
Mm-hmm.
get in. What I would be cautious with is if this were something in a public sort of environment, then that would be something that would be a no.
Right.
But if it's on your own yard and you know how you're taking care of it from a sanitary perspective,
Mm-hmm.
then you're good to go.
That's what I would say too.
Just don't invite all the neighbors over. This is
Right.
still social distancing, and for that matter, I wouldn't even let anybody get into our own family pool
Mhm.
if they're not living in our household.
That's the best way to do it.
Yeah.
Exactly.
Mm-hmm.
Let's see. Someone's asking. C. Johnson says, when is it safe to go back to the salons?
Whew. We're gonna give that a few months, okay? But I know I know people are yearning to get to the salons, but that is a very close proximity. I mean, you're having a stylist that's in your face, in your hair, you know, and Lord forbid is you sitting there for a couple hours.
Mhm.
This is not like
Exactly.
in and out type of quick procedure. This is a
Mhm.
long period of time that
And it's a procedure for many of us.
it's a procedure for a lot of us. And so, I don't feel that that's safe because of that reason. But also, if we're going and we're having on a mask, that gets quite uncomfortable. You're now constantly bringing in, breathing in your own carbon dioxide that you've exhaled. You're bringing in your oxygen. Breathing out your carbon dioxide, but then now with the mask over your face, you're breathing that in constantly while you're sitting there for 3-4 hours, or
Mhm.
heck, 5-6 hours. So
Mhm.
I would say let's hold off on that. Um, and there's a lot of great, insta weaves, wigs,
Wigs,
hair,
hats,
hair accessories,
turbans.
turbans, hats. There's all these different lovely accessories for your safety. So
I
safety first.
agree. I totally.
Now I will say this: if you have but even this is still kind of sketchy. But if you have a person that does mobile hairstyling, where they're coming in with just their self or whatever, and it's just you and them, at least that's a little safer than you being in a broad environment with other clients that's in a hair salon. But we still have to be careful, whatever that it is. I think
Exactly.
everybody is just still just trying to encourage to stay home, away from that type of scenario.
Because that's what's been working.
That's what's been working,
Yeah.
and we just need to keep that going until we really can see these numbers drop.
Okay, ladies, you heard that? Some of y'all
Mm-hmm.
already, some of you all, I'm not calling any names, and
Uh-oh.
they're related to me, have been to the salon, but we'll talk about that later. Anyway, moving right along. Chris Easter, my sister has another question. Dr. Mack, I've gone through chemo and finishing radiation. It has affected my hair. It's
Mm-hmm.
finally growing back too straight. Skin is itchy. Nails are scary. Any suggestions? That's the one who wants to cut off her daughter's hair.
Oh no, was that Chris?
Yes.
Oh, okay. No, we gonna definitely keep baby girl's hair.
Right,
Leave
right.
her alone. But now this is where I don't know if your viewers have known about my supplement Bella Nutri, but my product Bella Nutri works internally. That helps to get the hair follicles as well as the skin cells healthier and revived and rejuvenated. So even I've had tons and tons of folks that are post chemotherapy, that those follicles which shut down during the chemotherapy process can now get revived and start growing the 2 to 3 strands of hair they're supposed to grow. Now, it takes on average up to about 4 to 6 months for those follicles to really get back revved up again to start seeing some changes. You'll start seeing some skin changes as early as about 2 to 3 weeks. Now, you described some itching. Now, I'm not sure if that. I mean, have you always had the itching? Is it relate? Is that related to the chemo, or maybe there's something else that's causing the itching? Because that's generally not one of the major side effects of chemo. But you know, you can actually, I mean, you can definitely contact me offline if you have any questions through my Ask Dr. Mac, askdrmac.com, and I'll be happy to kind of flush out because there may be something else that I can better guide you to your doctor in your location. But definitely with the hair, Bella Nutri, 2 capsules per day for at least 6 months. Amazing changes with the hair, and then even the anti-aging benefits with the skin. So and I should have mentioned that to one of the other viewers that was talking about, was that Ashley that was talking about using the retinoids for preventative
Oh,
wrinkles
yes.
or whatever. We can do better than that. We don't have to use the topical irritating retinoids. This is where my Bella really helps as an anti-aging and keeping those fine lines and wrinkles away because of the special collagen protein that I have in Bella Nutri. So yeah.
Awesome. So,
Mhm.
Chris, I'll be sending you some Bella Nutri.
Right.
I think we had that, I think, answered some of Michael's question, which was she wanted to hear about your Bella Nutri products.
Okay.
So
Yeah.
I think you answered that question.
Mm-hmm.
Marianne Royal, another soror,
Mm-hmm.
she,
Okay.
her question is, her nails are splitting. Do you have any suggestions? Now, and I was one of those people that went to the nail salon, got the nail things. I haven't had them since they came off after the pandemic. And
Mm-hmm.
now I'm at the point where I don't think I'm ever going to get them back again because I'm doing just fine without them. Um,
Right.
and I noticed that as they're growing out, I can see the good nail coming in, the bad nail going
Mm-hmm.
out. So, what recommendations do you have for Marianne and myself for our nails throughout this season?
Right. Well, with the key is with the nails, you definitely don't. A lot of times we end up picking with like the cuticle and start trying to shave that away, but that's important to keep that in place because that prohibits like anything from getting up underneath
Mhm,
into that nail bed, which can cause the nail to be damaged and not grow out
mhm,
as healthy. Um, keeping the and then keeping it moisturized. Using some sort of cuticle oil. Here I go again with olive oil, but it loves the keratin protein, which
mhm,
is what our skin and our nails are made of. So just simply rubbing alcohol on the cuticles. Internally, of course, we just talked about my Bella Nutri, but the
mhm,
the Bella Nutri also helps with the nails as well. Actually, within like as early as 1 or 2 weeks, you start to see a great improvement in the color of the nail and how
mhm,
fast it's growing out and just the overall moisture retention because of the hyaluronic acid that's in the product. But nails too are an internal structure that manifests externally. So the
mhm.
more things that we can do internally for our nail health is going to be the best. So yeah.
Okay.
Hmm.
All right, great answer to that.
Hmm.
Jerlyn Cummings McLeod or McLeod, I think it is, says she needs to put in her 6-month order of Bella Nutri. Are
Oh,
you open? So maybe we can put your
yes, we've
website
been.
on the screen.
Oh, right. The pandemic did not slow down orders. Actually, it picked it up, which is a beautiful thing. I thank you for the favor, good Lord. But no. So yes, we still are shipping out. Here within the U.S. as well as internationally. So I think this is one thing that the pandemic has done is people are really focused on self-care more, like looking in the mirror more, trying to figure out what they could do for their skin, their hair.
Mhm,
Because during this anxious time that we're in, we're also accelerating the fine lines and wrinkles. We're accelerating our hair shedding more. So
Mm-hmm.
it really is sending a real overall stress component to our body. And unfortunately, it can reflect in how you look and how much your hair is going to come out and how many wrinkles and how many gray hairs that are going to pop up.
Well, I don't want any of that. So,
The
so
color industry is increasing.
right. So, what is your website, Dr. Mac, so we can let the people know how to get you?
Yes. It's we're gonna just go with askdrmac.com.
Okay.
AskDrMac. And they can shoot me questions through contact us, and the questions come directly to me. And I try my best to, there we go, AskDrMac. And definitely I'll be happy to answer their individual questions and give some guidance. I mean, of course, what I do does not, as a disclaimer, I do not replace what your own dermatologist or your own medical doctor is telling you to do. I'm only helping to keep you from going to Dr. Google, number one, because Dr. Google can take you in a whole bunch of, when it comes to skin stuff,
Mm-hmm.
especially, Dr. Google can get folks in trouble because so many different skin rashes look the same.
Mm-hmm.
But depending on the underlying symptom that's associated with it or how it's looking, like the average eye may not see what we can see. So I definitely don't want someone going to Dr. Google. So ask me first, and then I can be able to better guide you. Make sure you're on the
Awesome.
track.
Okay, great. And I'll put that back up on the screen before we leave out. I have another question here from Sherry Page Robertson. Since
Okay.
the spas are closed and we can't get our eyebrows and lips waxed, is it better to shave or pluck the hair?
Uh, well, plucking creates more trauma
Mhm.
to the hair follicle, which I'm less likely to say that because the hair follicle has pigment cells around it. So if you have any, depending on how much color you have in your skin, the more you pluck and traumatize that area, the darker that area is going to get, and it's going to end up looking like, speckles. Shaving is just going to really, it just kind of, shaves the surface, which is, which is actually much better. And it's going to not give you as much what we call hyperpigmentation
Mhm.
or darkening of those individual follicles. So go with the shaving. It's much better.
Great. All right. Well, these were some good questions,
Yes.
and I learned some things today. Then I think
Right
everybody
about those
learned.
fluorescent lights. Is that a fluorescent light in your office? Right? No, maybe not. No.
Not here, but I didn't know I needed to have on sunblock in the office.
Yes, that's right.
I didn't know that. So I'm going to put your website back up. So, oh,
Hmm.
that's not the right one. Here we go. And if you need to reach Dr. Mac, you can go to www.askdrmac.com.
Yes, happy to answer their questions.
Try out the Bella Nutri. It's the bomb. And
Yes.
I will be sending some to to my sister Chris.
Right. Let me
Um,
take care, sister.
yes, we must do that. So thank you guys for having your questions ready. That was really great.
Yes, that's
And I
excellent.
really enjoyed this session we had, Dr. Maclin. Appreciate you
Yes,
coming on
thank you,
board.
Dr. Ian McAttack. I love it. Thank you.
I think somebody else has a question I'm gonna just put out there before we go. I try to get to everybody. C. Johnson, speaking of rashes, can you clarify the cause of shingles? Can you get shingles if you've never had chickenpox?
Shingles is from the herpes virus. You would have had to have chicken pox
Mm-hmm.
in earlier years in order to get shingles. So it is a type of herpes simplex virus, okay? And yeah, and
You
it
have to
can
have that chickenpox.
chickenpox. But if you've gotten the vaccine, then it's less likely
That's
for
likely.
you to get chickenpox or the shingles.
Right, exactly.
Mm-hmm.
All right, you guys. So this was
All
great.
right.
I'll be coming back to you later on in the weekend with some more info. I really had a good time. This was
I had a good
good.
time. Thank you,
So
Dr.
we're going to close out like we always do with prayer, and
Mimi.
that
Okay.
everybody has a blessed rest of their evening. So, Father, in the name of Jesus, we thank you for the session today. We thank you for the questions that got answered. We thank you that we got knowledge today that we can use use it and apply it to our lives. I ask you to bless Dr. Maclin and her family, May there be no lack, mind, body, soul, spirit, financially, in the name of Jesus. We thank you for just building her up in her knowledge, in her business. And we thank you that she's poured out on this group tonight and those who will even listen in a future date. We thank you right now, Father, for everyone who's listening. We ask you to continue to bless them in their homes, at their jobs, with their families. We thank you that there's no lack. When they go to the store, they get what they need. Father God, we ask you right now to bind the enemy right now. We thank you for a hedge of protection you've got around us throughout this season. And we thank you most of all for a peace of God that pass all understanding, because you do not give us the spirit of fear, but power, love, and a sound mind. So we put faith over fear right now. We should not worry about anything, and we have no lack for anything. And we give you praise, we give you honor. We're calling it all done. In Jesus' name, our friend, amen. All right, guys, it's Dr. and Dr. Mac with
Pass the sword, doctor.
Bye, guys.
And bye-bye. Have a good night, everybody.
Thanks you.